Ahead on Daytime Buffalo, we recognize Brain Cancer Awareness Day with Hope Rises and local advocates who are offering extra care to those impacted by the disease. And later, we also highlight National Water Safety Month with the YMCA and hear more about their Phones Down, Eyes Up campaign. It's all coming up right now on Daytime Buffalo. Good afternoon, hello, and welcome to Daytime Buffalo. I'm your host, Chelsea Lavelle. Well, May is Brain Cancer Awareness Month, and for this week's Hope Rises segment, I'm joined now by some people who've made it their mission to educate others on the impact of brain cancer and support those who have been affected. So first, we'd like to welcome our friend Kate Glazer. Thanks for coming in.
Thank you, Chelsea, for having us. Obviously, Brain Cancer Awareness Month is a huge month for those who are advocating for better treatment, better care, more hope. I'm bringing on my good friend Shannon Trapp-Hagen from GameOnGlio podcast. Very inspiring podcast that really shares stories about brain cancer and support and hope. And also Dr. Jay McCracken, who is from GammaTile therapy, an essential part of the healing and treatment for those fighting brain cancer. So honored to have you both on today.
Yes, thank you so much for coming in. Shannon, I'm gonna start with you and ask you to share a little bit about your personal story and your history with brain cancer.
Sure. So my story started in 2019 when my 44-year-old husband was diagnosed with glioblastoma, which is the most aggressive form of brain cancer. 14 months later, he died from the disease at the age of 45, and that propelled me into this world of advocacy, education, and hope for those with rare cancers like brain cancer that just don't even know where to turn. And that started with the podcast, GameOnGlio, which exploded in its first season and was not something that I actually was thinking I was going to be doing long term. And that turned into a media business with Right Life Media, and we now work with biotechs and companies like GammaTile to get their message out about the work, the vital work that they're doing in brain cancer, and to honor my husband's memory as I continue on this journey.
Let's talk a little bit more about how you first got involved with GammaTile therapy.
So GammaTile was actually one of the first sponsors and first partners I started working with years ago in 2021 when I started GameOnGlio. And at the time that my husband was diagnosed, GammaTile was just coming on the scene, and so it wasn't even really an option for us at the time. By the time I had started the podcast, GammaTile was popping up in hospitals all across the nation, and I was seeing the profound benefit that it was offering patients and the hope that it was giving patients, and I knew that it was something I needed to be a part of. And so I reached out to them and we started partnering in 2021, and it's been an amazing partnership ever since.
Nice. Alrighty. Well, Dr. Jay McCracken, I'll go over to you now to just kind of explain more about GammaTile therapy and how it's supporting patients with brain cancer.
So GammaTile is an implantable radiation source. So unlike traditional radiation where it's delivered outside of the body after a procedure's been completed, this is something that we do actually at the time of surgery. So we will actually go in for a planned surgical resection of a malignant brain tumor, and then we actually implant these radiation sources within the resection cavity after it's been completed. The wonderful thing about it is that it starts to work immediately, so that radiation is delivered to any residual tumor cells which are left behind, and starts working so that you don't have to avoid the time delay, which is typically anywhere from 3 to 5 weeks after surgical resection. So patients get immediate benefit therapy.
So how is this really saving lives?
Well, I think it really provides an opportunity to kill cancer cells much quicker, because in a lot of the malignant brain tumors that we treat, there can be a tremendous amount of regrowth between the time somebody has surgery and then the time somebody gets external beam radiation therapy. So this allows us to not only stop the tumor immediately with surgery, but then also start treating in sort of an adjuvant fashion much quicker to prevent any sort of regrowth of tumor and really obtain excellent local control of the mass that's been removed.
Amazing. Okay. Now, have there been any new advancements or achievements for those fighting brain cancer?
Well, I think with respect to what we're doing with this implantable radiation therapy, I think what we're seeing is very durable local control which can sometimes be difficult to achieve just with traditional external beam radiation therapy, whether we're talking about glioblastoma or brain metastases or even some very aggressive malignant meningiomas. And so I think what the data is showing us over the past several years that it's been out sort of not only from the original clinical trial but also in the commercial phase is that we are achieving much more durable control for longer periods of time, which I think is very hopeful for patients.
Well, speaking of hope, Shannon, what is your hope with working closely with GammaTile therapy and using your podcast to kind of spread more awareness?
Honestly, my hope is to help patients and families find options that aren't otherwise available. It's navigating the healthcare system is so hard. Getting a cancer diagnosis that's terminal is that much more challenging. And so to be able to say, you know, we have options. A lot of times you go to clinicaltrials.gov and you're just inundated. You're inundated with information and you don't know what's going to work best. You don't know what's going to be the best fit. And my hope is to be a voice for those who are voiceless and who don't know what to do and who don't know where to go. And if we can provide that platform and give them options and do patient advocacy and give them a sliver of hope in something that could just push the needle or get them that much further down the road, then I've done my job.
Absolutely. You are doing it. You're doing amazing work with this. Thank you so much for coming on and sharing more. Kate, thank you for bringing them in and continuing to spread awareness, especially with, you know, your support of pediatric cancer as well. Viewers, if you'd like to learn more about this collaboration and find more resources for brain cancer and grief support, you can visit the GameOnGlio podcast.com. Thanks again for coming in.
Thank you so much.